Hello again and welcome to today's Canton Charge Community Shoutout. I'm Scott Zurilla. Glad you are with us. And it is a real pleasure to welcome in Lilly Davenport, the Consultation Education Prevention Coordinator for Stark County Mental Health and Addiction Recovery. Lilly, thank you for joining me. How are you today?
I'm doing great. How about you?
That is great. I am doing well. Thank you. That's quite a mouthful to get things started. So I'm going to shorten things up and refer to it as Starkmart, if that's okay for you.
Oh, that's great.
Good. Now, with that said, Starkmart has a wide scope of programming, Lilly. In a broader sense, what is it exactly that you do?
Yes, absolutely. We do so much. So I appreciate you saying in a broader sense because people often say, like, what is it that you guys do? You do so much. We are connected with so many different community partnerships. So I like to say, like, in a nutshell, we want to provide hope, wellness, and recovery for all folks in the community. And I think we do a great job by doing that with utilizing funding to be, innovative, collaborate with community partners by looking at different programs that might be needed within the community and being able to just kind of add our input and collaborate and create, wonderful programs to meet the needs of those in the community. I think another huge piece for Starkmart is our education. Especially now, people just need to be educated about mental health, addiction, and recovery. And so that's a huge component of the things that we do. We want to ensure that the community is educated about the services that we have and the services that can be provided for folks within Stark County and especially our underserved communities. Another piece is being an advocate. So we have so many folks within our system that need our support. And so we love to support them and show them that, we want to support them on their journey through, their mental health and their addiction and recovery.
Lilly, it's well documented at this point, the 14, 15 months of the pandemic and what it's done to so many people in so many ways, especially mental health. I know that mental health among youth is such a concern in Stark County. How is your school-based clinic services able to aid in that?
Yes, absolutely. So I think one of the great things about our school-based clinical services and our prevention services is that we were already connected with the school districts prior to the pandemic. And so that was a strong suit for us because we partner with the Educational Service Center along with these school districts that we are connected with and partner with. And if it was not for them, we would not have been able to connect with the families and the students that we've been able to connect with. And so there are 93 buildings within Stark County that have clinical counselors in them. And we contract through child and adolescent behavior, Conquest Services, and Pathway. Those are our contracted providers that are within those school districts that are providing these great services. And those folks, those clinicians and prevention providers have been so flexible and been so innovative themselves on how to connect with these kids and families.
Lilly, we hear so often with physical and mental situations that, prevention and early diagnosis is so important. What are some of the community prevention programs that you provide along those avenues to, again, try to get to things early in hopes of preventing things from getting worse?
Absolutely. I can go on and on about prevention. It's such a key component. One of the great things about our prevention is not just community prevention. We have our school-based prevention. And so we start that early off in our pre-Ks. And so we have provider agencies that are working in pre-K child care centers and pre-K schools that are providing prevention services. And then our general prevention services in our schools go through third grade through 12th grade. With our community prevention, I'm so excited about that. That's one of our newest components. And we have Strong African American Families, which is a curriculum obviously focused for our African American families within Stark County. But then we also have Strengthening Families, which is for all families within Stark County. And this is where we bring in that parent piece, which is huge. Really bringing in that parent component to draw families in and make kiddos feel more connected, not just with their parents, but also within their community.
Lilly, as we wrap things up, as I said, the pandemic has just wreaked havoc on so many people in so many different ways. So anyone out there that maybe would like to help you out, support you, or maybe even more importantly, may need your assistance, how would you recommend that they can reach out and contact you?
Sure. I always tell people, check out our website. It's great. Our marketing department does a good job with that. I always give them a shout out because they make sure that our website is up to date. So starkmart.org. That's our webpage where you can join coalitions, look up contact information if you're trying to look for me, if you're just trying to get some guidance on how to join some of the work that we're doing, or just kind of be aware. Our webpage is a great place. Also, our Facebook page, Stark Mental Health and Addiction Recovery on Facebook, you can always check that out. And that can give you some updates on events or things that we're doing or who we're partnering with at that time within the community. Obviously, if folks are struggling and they're having some, deeper issues and they need to reach out, I always say, reach out to our crisis text line, which is 741-741, and you'll want to text HOPE, HOPE, or our crisis hotline, which is 330-452-6000.
Lilly, give both those numbers one more time just to make sure.
Sure. The crisis text line is 741-741, and you'll want to text HOPE, HOPE. And then our crisis line, our crisis hotline is 330-452-6000.
Lilly Davenport of Starkmart, thank you so much for the time today. All the best moving forward.
Oh, thank you so much for having me.